Doctors Today. The latest developments in the world of medicine. This is a program of special interest to girls who are at least 18 years of age and not less than 5 feet tall. If they have a high school education, if they are in good health, and if they have a real love for humanity, this is their opportunity for a career that will make them truly happy. The American Medical Association, in cooperation with the National Broadcasting Company and its independent affiliated stations, presents Doctors Today, a weekly report on the progress of medicine and surgery in America. This week, a report on the urgent need for 7,000 young women. We first hear Dr. William W. Bolton, speaking for the American Medical Association. Dr. Bolton.
If you live in a modern American community, there is at least one young woman in your neighborhood who has a very important job. Her job is to keep people healthy. Hundreds, perhaps thousands of children will never have diphtheria, scarlet fever, or other contagious diseases, thanks to her. When she visits a home and finds someone sick or disabled, she will gladly offer expert advice on the prevention of illness. With all of the good she does, with all of the people who never become sick because of her, and all of those that she has helped to make well, you may wonder why you haven't read about her work. Unfortunately, she doesn't do the kind of work that makes headlines. That's why we have set aside this coming week in appreciation of our public health nurses. You may have problems of your own, but I think they'll seem a little easier if you will devote the next half hour to an understanding of the problems of public health nursing. Here is a dramatic story of Helen Keenan, one of 21,000 public health nurses in this country.
Why did you stop?
Oh, I've got a little surprise for you, and I decided that this was the place to tell you. Isn't this a nice view of the lake?
Very nice, Don.
Full moon on the water. Beautiful, isn't it?
Oh, it's perfect. But I thought we were on our way to Martha's cupboard.
Oh, we are, and we'll go in a few minutes. I have some news that I've been saving for you.
Oh.
Can you guess what it is?
Let me see. Oh, I know. This is the anniversary of your first major operation.
No, darling. Nothing like that. Come on, try again.
Oh, can't you give me a hint?
Oh, yes. Let's put it this way. The impossible has happened.
The impossible? You're being very helpful, aren't you, Don?
Now, Helen, if you'll just stop to think what we've been hoping for all these months.
Oh, I know. You finally found an office of your own.
Oh, that was pretty close, but you're still on the wrong track.
Well, what's my reward if I guess right?
Oh, nothing cheap like a mink coat or a set of silver. Guess what? And I'll even go so far as give you a kiss.
Oh, no. Why, that's too much to ask for. Now, Doctor, don't be so extravagant.
This offer is good for only one more minute, and besides, it's limited to you. Now, come on, guess.
Dr. Andrews has decided to retire, and you're going to be the chief surgeon.
Oh, darling, that's just wishful thinking. That wasn't a good guess.
Well, I give up. What is it?
I found an apartment.
You did?
Yes, 4 rooms. Big living room, nice kitchen, little room for a study with a place where I can stack my books.
Oh, how wonderful.
I even signed a lease. We can move in the 1st of May. Now, when do we get married?
Well, do you still want a honeymoon?
Oh, I certainly do. I've got it fixed so I can be away from the hospital for 2 weeks.
2 weeks? Oh, that's a long time, mister.
Oh, but you do want a honeymoon, don't you?
Oh, darling, you know I do.
I can arrange to get away from the middle of April to the 1st of May.
Oh, I'm afraid that's out of the question.
Why?
Well, for weeks, Dr. Palmer's been trying to get 2 more public health nurses. And he can't let me take a vacation until he finds at least one.
Oh, but you'd only be away for 2 weeks.
Oh, Don, he just couldn't spare me until school vacations start. Well, I'm not even sure that he can let me go away in June.
Oh, Helen, this isn't fair.
Oh, now, darling. You know perfectly well that I'll set the date as soon as I can. But we want a nice honeymoon, so we'll just have to wait.
I think I'll go over and have a talk with our public health office. Dr. Palmer must be able to find at least one public health nurse.
If you can find one, just one who's qualified, I'll bet he'll be willing to buy you a new hat.
Oh, but he teaches public health. He must have some student nurses who are graduating in June and who want to specialize.
Well, all I know is what he tells me. There just aren't any to be had.
Well, by George, if he can't find them, I will.
Who knows? Maybe you can. After all, you found an apartment, and I didn't think we had a chance.
Not only that, but I found you. If I can't find another public health nurse who's willing and able, I'll kidnap one.
Calling Dr. O'Brien.
Good morning, Dr. Martin.
Oh, Berwick. And did you get my message?
Yes. Sorry I couldn't make the staff meeting. I was down in emergency.
So I understand. Can you spare a moment now?
Yes.
Well, let's go into my office. I've got some good news. Here, sit down.
All right.
Don, for the first time in 4 years, our nursing school has a full enrollment for the first-year class.
Oh, that's great.
But as you probably know, the class that will graduate this June is quite small.
Oh, yes, I know.
Now, our problem is to keep as many of our graduate nurses as we possibly can.
Oh, yes.
Now, some of them will want to go on and specialize. I see no objection to that so long as they specialize in lines that will keep them here in the hospital, such as dietetics, surgery, physical therapy, and so on.
Well, I get your point.
But we certainly don't want to encourage them to specialize in vocations that will take them away from the hospital, such as public health nursing.
Oh, I understand.
Now, the other day I learned that Dr. Palmer is looking for a couple of public health nurses.
Oh, yes, I heard a rumor to that effect.
Now, I sympathize with Dr. Palmer's problem, but well, after all, our nursing school is primarily for the purpose of providing nurses for the hospital staff.
Yes, certainly.
He's giving a course in public health administration. And I wouldn't be surprised if he's trying to influence some of the girls to take special training as public health nurses.
Oh?
If you get a chance to speak to them about it, Don, I'm counting on you to explain what a fine future they have right here in the hospital.
2 cases of measles at the Crane School. Both children at home with placards on the door.
Did you visit them?
Not yet, but I will tomorrow.
All right. What about that just wiki boy?
Oh, I saw him today, and he's on crutches now. I gave his mother some more suggestions.
And what about that family out on the west side of town with 2 cases of tuberculosis?
Oh, you mean the Krugmans?
Yes.
Well, I was out there today. Dr. Jolson is sending the father to the sanatorium. The oldest boy is coming into the hospital for another X-ray.
Good.
The mother had another X-ray last Monday. And the rest of the children are probably infected, and they're going to Dr. Jolson's office for tests.
That's fine.
Now, you want to know about the Armstrongs out on Central Avenue, Doctor?
Oh, yes. Possible typhoid.
Well, Dr. Fisher has decided that it isn't typhoid. Just a severe stomach upset. So, we're all clear on Central Avenue.
Well, that leaves you with nothing to worry about until 9 o'clock tomorrow morning when I want you to visit the Jackson School.
Yes, of course. Dr. Palmer.
Yes?
When will it be possible for me to go on my vacation?
Vacation? Oh, Miss Keenan, let's not even think of vacations now. You know what the situation is around here. You know that I'm trying my darndest to get 2 more nurses.
Well, yes, but, you see... Well, I'm thinking of getting married.
Married? Oh, don't tell me I'm going to lose you. Why... Oh, Miss Keenan, please don't do this to me.
Oh, I plan to keep on working for a while, Doctor.
Well, thank heavens for that. But, how long do you want to be away?
2 weeks.
2 weeks? Do you realize what might happen while you're gone? Whooping cough, possible mumps, or even a scarlet fever epidemic. Oh, no. I can't spare you at this time.
All right. I'll tell him. He's a doctor, so he'll understand.
The doctor? Do I know him?
Oh, yes, I'm sure you do. Dr. Berwick.
Why, of course. He's a fine surgeon. Well. You're both very fortunate.
Oh, thank you.
Say, this gives me an idea. I have 2 girls in my class who are interested in public health nursing. Maybe Don can put in a good word for us.
Oh, I'm sure he'd be glad to. He's promised me that he'd help find at least one.
Come in.
Hello there.
Well, look who's here. We've just been talking about you.
Oh?
I hear that you and Miss Keenan are going to be married. Congratulations.
Thank you.
The only question is, when can she set the date?
Dr. Palmer, you have the answer to that question.
Yes, I know, and I'm going to give Helen her vacation as soon as possible. But we've just discovered that you can help us.
Oh, I can? How?
Do you know Miss Carter?
Oh, yes. Know her very well. She's been in surgery for the past 2 months.
And how well do you know Miss Peterson?
Let me see. Oh, yes, that's the little nurse with the red hair. Sylvia Peterson?
That's right. Both Miss Carter and Miss Peterson are thinking very seriously of taking up public health nursing. If they came to you for advice, what would you tell them?
Well, now, we really need Miss Carter in surgery, and I've heard that Miss Peterson is very helpful in OB.
Oh, come now. You could spare them, couldn't you?
Maybe I'd better ask Miss McCormick about that.
Now, Don, you know what she'd say. She's trying to keep all of her June graduates.
Dr. Palmer, aren't there some of the married nurses who'd be willing to go in for public health nursing, at least on a part-time basis?
Yes, there are, but I can't put them on my staff.
Oh, why not?
Because they haven't had specialized training. They couldn't begin to do the job that Helen does.
You see, Don, there's a lot more to public health nursing than you're willing to admit.
Now, Dr. Palmer, don't you think they'd get by?
No. I made you a proposition, young man. How about it?
You're really putting me on the spot, aren't you?
Well, I happen to know that the student nurses have a lot of respect for the job you're doing. I'm sure they'd be inclined to take your advice.
Helen, this man is asking me to enter into a conspiracy against my own hospital. Imagine what Dr. Martin and Miss McCormick would say if they heard this.
Well, what's wrong with giving a girl advice on her vocation?
Don, I'm trying to arrange for Helen to get a vacation so you can be married and go on a honeymoon. Is there anything wrong with that?
Well, no, of course not, but... Oh, darling, I can't honestly advise Miss Carter and Miss Peterson to go in for public health nursing. We need them too much. Besides, they're hospital-trained, not public health-trained.
All right. This means that we'll have to postpone our wedding for at least 2 months, possibly longer.
Well, I'm sorry.
Doctor, I respect you for having the courage of your convictions, but let me ask you this question. Do you think that the work that Helen is doing is less important to public health than the work that Miss Carter and Miss Peterson are doing?
I really don't know the answer to that question.
Well, I think I do, and I'm going to call for a showdown over at your hospital. If I'm going to teach a public health course, then the least I expect is to have a couple of the nurses go into public health.
And now, Dr. Martin, if I may be excused.
Oh, no, I think you and Dr. Berwick would better stay for a few minutes. Dr. Palmer wants to see us. For some reason, the good man seems to have a chip on his shoulder.
I think I know the reason.
Oh?
I sent him a memorandum asking him to be very careful to explain that the hospital needs all of its graduates at this time.
Too many wards and not enough nurses. Oh, Don, will you look over these x-rays of... come in.
Hello.
Oh, Dr. Palmer, come right in. We've been waiting for you.
Oh, hello, Miss McCormick. I received your note.
Oh, that's fine.
I know you're all busy, so I'll try to make as little of your time as possible. Now, Miss McCormick.
Yes, Doctor.
I understand that you're doing your best to keep all of the girls in your June class on staff.
Yes, we need every one of them.
Much as we'd like to help you out, Dr. Palmer, we really can't spare any of them.
I understand your problem, but I need 2 nurses, just as much as you do. Miss McCormick has practically asked me not to encourage any of my students to specialize in public health nursing.
Yes, she told me.
And I suppose you approve?
In view of the circumstances.
May I ask if you consider it more important for a nurse to prevent disease than to help cure disease?
No, of course not. The public health nurse is just as important as the nurse in any other specialty.
Dr. Martin, I must have 2 more nurses go into public health training.
Now, George, we know you're doing a grand job with your present staff, and if you'll just be patient for a few more months...
No, I'm sorry, but we're not doing a grand job. We've been obliged to neglect cases that need immediate attention. Now, it seems to me that every nurse has a right to choose her particular field of endeavor.
Oh, yes, naturally.
Therefore, why shouldn't her teacher have a chance to point out the opportunities in the course that he teaches? Isn't that only fair?
Well, yes.
It seems to me that if we're going to have a course in public health, that the girls should have a chance to know what the subject offers them as a career.
Yes, I suppose we have no other choice.
Now, just a minute here.
Yes, Miss McCormick.
You may not know who he wants, but I do. And I think it'd be a shame to lose them. You want Miss Carter and Miss Peterson, don't you, Dr. Palmer?
Yes, if they're interested.
But we need Miss Carter in surgery.
Yes, and Miss Peterson's doing a fine job in OB. Now, why should we encourage him to walk off with two of our best nurses?
When they get their diplomas, they have a right to do as they please, haven't they?
Yes, but I know what'll happen if you give them another one of your high-powered sales talks.
Oh?
I can't compete with this man, Dr. Martin. He has a certain something. In fact, he almost made a public health nurse out of me. Why, when I was in his class...
Miss McCormick, I'll talk to the girls about the whole situation and they can decide for themselves. Meanwhile, you can say what you like to them, Dr. Palmer.
Excuse me. Don, I'm sorry, but I'm just too tired for a movie tonight. I had so many calls today, and I walked just miles.
Now, Helen, how much longer are we going on this way? You're doing the work of two nurses.
Don, I'm sorry, but it can't be helped.
The trouble with you is that you take your job too seriously.
Oh, is that so?
Look at you. You've lost weight. How many pounds have you lost in the last couple of months?
I really don't know.
Well, I would say at least 10. Now, darling, you've got to slow down. You're running yourself ragged. You've got to take a vacation.
Don?
Yes?
I found a boy today with an acute, rapidly spreading infection in his knee. His mother was trying to treat it with a poultice. She finally agreed to call a doctor. That boy might have lost his leg. I found a girl who'd been out of school for 3 days. Her mother was going to send her back tomorrow with what I feel sure is scarlet fever. Now, I ask you, how can I go away on a vacation when I know perfectly well that there's nobody to take my place?
I know, but there are limits. You've got to get away for a while.
Do you think I'd enjoy a honeymoon wondering if some child might be coming down with polio, with some careless mother thinking it was just a bad cold? I'm sorry, Don, but I'm just not built that way.
Helen, you take your work too seriously. You're trying to do too much.
Don, there are some things that you don't seem to understand.
Now, just a minute.
Sometimes I wonder about you.
Oh, I see. Very interesting. Tell me more.
Sometimes I'd just as soon give you back your ring.
Oh, you would? Well, that's your privilege.
Oh, right here you are. Take it and marry some nice little girl who'll appreciate you.
All right, if that's the way you want it.
Glad to get it back, aren't you?
No, I'm not. I'll be honest with you. This really hurts.
Oh, Don.
Darling, I've said things I don't mean, and you did the one thing that you knew would hurt me.
I'm sorry.
Please, now, let me put it back where it belongs.
Oh, please do.
Oh, sweet, we've had it kind of rugged, haven't we?
Oh, yes, but, Don, I simply can't.
I know you can't. You can't walk off your job and leave those kids to shift for themselves any more than I can walk out in the middle of an operation. Oh, but you've got to have help. You look so tired and worn out lately.
Well, Dr. Palmer says he might be able to get Miss Carter, possibly even Miss Peterson.
When?
Well, he thinks he might be able to give me a vacation by the middle of June.
Well, how would you like to come to lunch with Miss Carter, Miss Peterson, and me? Of course, I won't try to influence them, but there's no reason why you shouldn't speak your mind.
Oh, Don, I think that's a wonderful idea.
Emergency, calling Dr. Fisher. Emergency, calling Dr. Fisher.
Oh, Dr. Berwick, can you spare a minute, please?
Yes? Oh, Miss McCormick, what's the matter?
Well, if somebody doesn't do something about that man pretty soon, I'm going to blow my top. I can stand just so much of his meddling and no more. This is the end.
Who are you talking about?
Oh, let's go into the X-ray room for a minute where we won't be overheard.
All right. Now, what is it?
I shouldn't take up your time with my troubles, but At least I know that you sympathize with my problem.
But what's the problem?
Dr. Palmer is the problem. That man.
Oh, now what's he done?
Well, as you know, Dr. Martin gave him permission to talk to his class about the joys of public health nursing.
Yes?
Well, I wasn't on duty at the time, so I was able to hear his remarks. Well, you've never heard such a talk in all your life. He had them laughing one minute and close to tears the next. Well, even I was taken in.
Well, he had his say. Now it's our turn.
No, I haven't been wasting my time. I asked Dr. Adams to give a talk to his class, and he did. He gave them such an inspiring lecture.
Good.
And afterwards, a lot of the girls went up and told him they were going to stay at the hospital.
Oh, I knew we could count on Dr. Adams.
And last night we had a party for our June graduates.
So I heard.
I had a nice heart-to-heart talk with some of the girls, especially Miss Carter and Miss Peterson. You know, they're the only two who are still on the fence.
Is that so?
Yes. And I felt sure I'd won them over. At least I did until this morning, when that man tried a low, underhanded, mean trick.
So you mean Dr. Palmer, of course.
Yes. Do you know what he did? He sent one of his public health nurses over to call on Miss Carter and Miss Peterson. Now, how do you like that?
Well, I don't suppose there's much you can do at this point.
She flounced into the hospital, all neat and trim in her uniform, being oh so sweet and efficient. Well, the first thing I knew, she'd invited them out to lunch at the Wayside Inn. Unfortunately, they were off duty until 6, so there's nothing I can do about it.
Well, there isn't much I can do about it either, is there?
No, of course not. But you being one of the unmarried doctors around here, and I know they have a lot of respect for you. You see what I mean?
No, I don't.
Well, you could say something in your class, couldn't you? After all, you don't want to lose Miss Carter in surgery.
No, but we could get along without her.
Well, it's just a suggestion. Oh, dear, look at the time.
Say, I have a date for lunch.
All right, Doctor.
See you later.
Oh, Doctor, there she is now.
Who? Oh, yes.
You see what we have to contend with? She's probably the only cute one in his office.
Yes.
Hello. Miss Carter and Miss Peterson will be right down.
Fine. Miss McCormick, I want you to meet my fiancée, Miss Keenan.
Your fiancée?
Yes.
I've already met Miss Keenan.
Yes, we've met.
So, you two are engaged. I didn't know.
Oh, yes, for quite some time.
Well, it's always nice to meet a public health nurse. You do so much. I really mean that.
Well, thank you. I'm sure you do.
Would you like to join us for lunch, Miss McCormick?
Join you? Well, you're already taking Miss Carter and Miss Peterson and Miss Keenan, aren't you?
Yes.
Is Dr. Palmer coming too?
No.
Oh, why not invite Dr. Palmer? I think that'd be the perfect luncheon. Well, excuse me. I'll see you later, Dr. Berwick.
Oh, Don, I did everything. What's the matter with those girls?
Well, look, Helen, I know how Miss Carter feels. She's so darn good in surgery. And Miss Peterson, well, Dr. Bremner says that she's the best nurse in OB that he's ever had. She just loves babies.
Oh, I give up. It's hopeless. Those are the two nurses who seem most interested. And Dr. Palmer was so anxious to have them study public health.
So they want to stay in the hospital.
Oh, Don. I'll go on with my work and you go on with yours.
Come in.
Oh, hello.
Hello.
Well, what's new, Miss Keenan?
Nothing. Had lunch with a couple of girls who are going to stay in the hospital.
Oh, no.
Yes, you really can't blame them, Doctor.
You mean Miss Carter and Miss Peterson?
Yes.
Well, I've good news for you. There's a new nurse coming in from Chicago.
Oh, really?
And even if I didn't have her coming in, I would insist that you go on a vacation.
Oh, that's wonderful of you, Dr. Palmer. But I'll be back. You can count on me.
That's fine. You both know what a big job we have here.
Yes, we certainly do.
I wish I had two more like you, who knew how much a public health nurse can do to save lives.
It is now my pleasure to present Ruth W. Hubbard, RN, President of the National Organization for Public Health Nursing, who will speak to you from New York. Miss Hubbard.
You have just heard the dramatic story of one community's efforts to solve a critical problem that exists in the country today, the need for more nurses. Multiply this community by 3,000 and you will have a more realistic idea of the extent of the problem. It is not that there are fewer nurses, but that there are more demands for nurses. This is especially true of public health nurses. Science is steadily finding new and surer means of preventing and curing illness. More and more communities are developing and increasing health services that will carry the benefits of this medical research into every home in the land. One of the key people in these programs is the public health nurse. From my own experience, I can say that there are few satisfactions equal to knowing that you have contributed your small bit to the recovery of a young boy from rheumatic fever, the safe arrival of a healthy baby, or the successful return to work of a father who has recovered from tuberculosis. To assist families to prevent the onset of illness or to meet and overcome it gives the public health nurse an abiding realization that she has helped the advancement of our national health today and tomorrow. Public health nursing is not a field for all nurses, nor does it call all nurses. It is a vital part of our total nursing service. Its members work in the homes, schools, and factories of our land. Here the public health nurse interprets the message of modern medicine to people in their natural environments so that they can use the new knowledge effectively. The rewards of public health nursing to the professional nurse are enhanced by generally good personnel policies which offer the security and freedom needed for original and constructive effort. The results are evident in the thousands of communities where families are bringing up healthy children, where mass x-rays are welcomed and the results followed up, where cancer is prevented, and where diphtheria is never seen. If you already are a graduate nurse and are interested in public health nursing, get in touch with your State Nurses Association's Counseling and Placement Service. This branch of nursing obviously requires special preparation during or after your basic training. If you are not yet a nurse but would like to become one, consult your local nursing council, your recruitment committee, or your visiting nurse association about the selection of an accredited school of nursing. The 21,000 public health nurses in our country will welcome you to their ranks as eagerly as Helen Keenan has just welcomed the public health nurse from Chicago.
Thank you, Miss Hubbard.
Doctors Today is presented by the American Medical Association through the facilities of the National Broadcasting Company and its independent affiliated stations. This program is presented on behalf of the thousands of physicians who are working night and day to protect and preserve the lives of 141 million Americans. The American Medical Association invites you to join us again next week to hear another report on the progress of medicine and surgery in America. Doctors Today, written by William Murphy, comes to you through the facilities of the National Broadcasting Company and its affiliated independent stations. The orchestra is under the direction of Bernard Berquist, with original music composed by Emil Soderstrom. The entire production is under the direction of Norman Felton. Heard in the cast were Donald Gallagher, Eloise Comer, Rupert LaBelle, Barry Hopkins, Hope Summers, and Georgianne Herbert. Your announcer is Henry Cook. This is NBC, the National Broadcasting Company.